Hi, and welcome to episode 2 of Inside the Healthcare World. Before we dive in, I just wanted to say a big thank you for everyone supporting my release of the episode 1 last week. It was very well received, lots of comments, likes and feedback, so thanks so much. There's a lot I can share with you, and hopefully the whole series will give a lot of value for anyone who's either trying to get into healthcare or is already in healthcare and wants to expand, or anyone interested in how actual healthcare works. So thanks again. Let's get into episode 2, which is all about regulations. One of the biggest misconceptions about entering the healthcare market is the belief that navigating healthcare regulations makes starting a healthcare business incredibly difficult. While it's true that healthcare is a heavily regulated field and some parts are more than others, from my experience, most businesses operating within a healthcare environment do not require as many regulatory hurdles as many people think. So let's clear up the confusion. The UK's healthcare regulations and standards are recognized globally. In fact, they are often seen as the highest benchmarks in the world. Many countries model their healthcare systems after the UK standards. You could compare it to how Germany is known for producing top quality cars, or at least they used to be. In a similar way, the UK sets a gold standard in healthcare quality and compliance. Where most people get it wrong is confusing a heavily regulated healthcare sectors with the entire industry, right? So the areas that demand the most capital and their rigorous, all the rigorous approvals are typically industries like pharmaceuticals, medical diagnostics, robotics, or medical equipment manufacturing. These sectors require years of research, clinical trials, and a significant financial investment to meet all the compliance standards. Naturally, breaking into one of those sectors is a monumental task. However, the rest of the healthcare industry is far more accessible. Sectors like healthcare, wellness programs, non-invasive solutions, they often have very straightforward regulations. And most people can navigate those without any specialized knowledge or experience. The general rule of thumb would be the more invasive services or products you want to sell, or in other words, the closer you want to be to a patient, the more regulations you will have on your way. The good news is the regulatory bodies provide a very clear step-by-step guidance on how to follow compliance standards, right? So even if you have no prior background in healthcare whatsoever, as long as you can find the relevant information, you can read and understand what it says and just follow the instruction, you'll be fine. By following those guidelines, you can ensure your business operates within the rules. And what's more important, it helps build trust. You can confidently deliver high-quality services, and your patients will know that they're in safe hands. Starting a healthcare business is not as daunting as it might feel. Sure, there are regulations, but they are there to ensure safety and quality, not to create barriers. Also, the way I see it as an entrepreneur is once you meet those certain standards, right? Once you get past all those regulatory, steps, that's your advantage. You are that much higher from somebody who's just about to start. So it gives you an advantage to be in a business, because if you can imagine, if you already set up your standards quite high because you followed all the regulatory requirements, whoever comes next and wants to copy you, they'll have to do it first in order to be where you are now. And most people would just get discouraged because they think it's hard, they don't want to do it, it's sometimes expensive, it takes more to go through that process rather than just setting up a business saying, oh, I'm ready to sell. So that is it for today. Thanks so much for your time. I hope it helps, and I'll see you next Thursday.